And we're going towards the end, but we still have one small pitching session. This is the pitching by the company with the beautiful, very Spanish name of Vermut, AgeTech Collaborative. And this is the startup pitch winner at the ViVE Conference 2025. ViVE is the event, the healthcare medtech event that happened in the middle of February in Nashville, Tennessee, in the US. Do we have the colleagues from Vermut here? Okay. Let's just I don't know how, it's just you? Just you. Okay, then I pass those to you.
Yeah. Okay, meet William. He's 68, he's a pilot, retired work hero, he's a diplomat. Still, last year he visited the doctor 13 times. And why? It's because he's bored. And probably because at night, if he goes to pee more than once, he thinks his prostate is going to explode. And I'm not prejudging, he's my dad. And I'm saying this because he's not just bored, he's alone, he's lacking social connections. And companies and services are throwing dependency products and services to him when he's not there yet. I'm Fernando, and I'm the co-founder of the first social prescription app for older adults. The population is aging. That's no news. In 10 years, 30% of the population is going to be an older adult. Smoking is healthier than being lonely. That's proven since 2 years now, and we keep on thinking the same services and products. This is the new older adult, people that is healthy, that is full of energy, that is digitized. My dad is the new older adult. And we're still focusing, as I said, on dependency and care. There's already a study in the UK that shows that if somebody is not socially disconnected, there's 40% less chances that they go to the general practitioner. At the same time, there's 6 billion on healthcare spend that is because of loneliness and isolation. Also, if you're socially isolated, there's 50% more chances of you getting dementia or Alzheimer's disease. So that's why in 2020, we decided to develop the first social prescription app for older adults. In a non-patronizing way, in a humble way, we approach an unattended segment to build something that was accessible and that allowed them to connect in real life with people with the same backgrounds and with the same interest. So you join the app, you meet people, you meet content, and you can create your own content and become an influencer on the platform. So in these past plus 4 years, we have more than 100,000 users in Spain. Our metrics are great. We have the opening of the app is more than 2 a day of the people that are active on our platform. Out of 10 people that open our platform, 1 is going to become a creator. That means somebody creating an activity in their city. And their activities convert 3 times more than activity held by a yoga teacher, let's say. And people that is looking for friendship, in average, make 5 friends a month in our platform. So there's a catch. The big problem is social engagement in real life doesn't scale. So that's what a lot of companies are seeing, and that's the reason they're throwing Zoom calls at them to solve the isolation problem. And we say that's not true. The problem is they're not listening. They're not looking into the new older adult, which is the baby boomer that is full of energy. Firsthand, we started B2C, and that's the reason we could see that the baby boomer is full of energy, and they are going to scale the platform for us. They are the key. So basically, through these type of people that become influencers on their communities, we end up being in the whole country with a small team. Now we're taking it to the next level, and we're ready to start approaching our strategy on the B2C. So we're having conversations with the biggest bank in Spain, moving forward with one of the biggest insurance companies, and we're launching the US with the support of the New York State. This market only in the US is 9 trillion. In the whole world is like 40 trillion. It's a crazy market. And the spend that the US has specifically on loneliness and isolation is more than 9 billion. That's what you could say by just connecting people with people. So we have a strong team, operationally, engineering, product, and more importantly, we can take a punch. As I said, we started B2C. We had to iterate in a space that nobody's doing any innovation so far in terms of social connections, and we're ready to take it to the next level. So if anybody's engaging in a population that is over 55 and wants to take your metrics to triple them and actually make them have healthier life, please connect me after this. Thank you.